choose from. She gets to put them in the box. She gets to place them the way she wants. Hopefully, and usually, she'll resolve it through her working things out through the sand, moving it around, manipulating it, empowering her. We don't change the sandbox. I'm involved with this too, even though I'm a practitioner. We don't change anything in the sandbox. She leaves. You take a...
Oh yeah, what's going to happen is that once she leaves, I will take pictures. So we're going to actually keep the sandbox the way it was, and then we'll take pictures. And I'm going to actually try to keep the sandbox the way it was, so that when she comes back for future sessions, she'll see that. So it won't be wrecked or anything like that. Okay, so she'll be able to actually leave with the image of what she just built in her mind. And then when she comes back, she'll actually maybe either start with that, or she might actually wreck it on her own. Okay, but she's open to be free and do what she wishes with that.
And how she manipulates the figures each week will show the process of her, recovery or her development. Hopefully she'll be learning new coping mechanisms.
So playing with sand is going to help her?
And what actually happens is it's successful with children because they feel safe to express their feelings and emotions in a way they cannot in words. With developmental thoughts. By manipulating the sand and the figures in it, it can resolve conflicts with the memories that the figures represent.
But these are unsafe feelings for her to talk about.
Yeah.
So.
Yeah. My question is that when she, how are we supposed to bring her in here? Because she's not comfortable with other adults. So her safe place is with us.
What I would probably ask is that when you actually go home, like, what are you planning on telling her, like, where you're going? Because you're going to be coming in with her, I hope.
Mm-hmm.
But what do you plan on maybe telling her for the first session? Like, how are you going to describe us to her?
To prepare her so
she feels
safe.
I don't know. I guess I would say that she's going to talk to a nice lady, and she's free to talk to her, and she doesn't have to stay. She can come. I don't want to tell her she has to stay. And that she can play with toys, and that she has a sandbox. And Tammy does like our sandbox. We have one in the backyard, so maybe I'll just talk to her about the sandbox and the toys.
Does she play with sand a lot at home?
She plays outside a lot, so
she enjoys it. She would probably engage herself.
Yes.
Okay.
So do you really think it'll work for her, just playing with sand?
Well, from what they're saying, I guess we can try.
It's definitely, like we've kept saying, it's definitely successful, it's definitely beneficial for children, especially if you've already saw alternative therapies, alternative counseling, things like that with her. But we also want to maybe meet with her for the first time to do an assessment. The nurse practitioner will also be involved, if that's okay, just to rule out other possible treatment options. And that's why when we talked about her history, making sure that we're ruling out all anger issues, and you said that she was diagnosed with ADHD?
ADHD. Yeah.
ADHD. So we want to make sure that there's no other mental health issues that could be a reason for this.
Right, the substance abuse from the mother may have left some residual medical issues.
In the therapy session for at least a little while, and like Donna was mentioning, that we won't be in the same playroom right away, because we want to at least get her used to it, maybe talk with her, maybe draw some pictures, those kinds of things, just to see where she's at, just for a couple weeks. And I would ask if you maybe came in, and then what we're hoping to do is maybe at like the third, fourth week is go into the sand playroom, and you could come in with that with her. But I would ask maybe stay in with her for a little while, see how she engages with the sand, see how she builds stuff, and then maybe secretly walk out and just or maybe step back a little bit, just to see how she does with you there. I don't know if she would actually be open to be talking to me, being able to build stuff with me, knowing you're there. But again, I would. And like she was saying, family model based, I would appreciate it to have you involved as much as possible. And then do you have a daughter?
Yes.
You have another child, and what's her name?
Sarah.
And how old is she?
10.
Okay, and I would ask maybe later on towards the end to bring her in, and we can try to see how they work together. Whether we have two sandboxes, or we have one sandbox and maybe Sarah does something else, or just seeing how they work with each other on various other things. And then just what Donna was saying is just bringing everybody together as a family, and just seeing how we can help each other out.
Okay.
Okay, I hope
hope so too. And, sorry, did you have something to say?
Well, I think that your treatment plan kind of validate what she really wants, something that's not traditional, something that is non-directive, because as you briefly know that she doesn't like any type of, she's not really fond of the traditional type of setting. So maybe this will give Tammy a better chance of really solving her inner issues. So, thanks.
When would you guys like to start?
Next Monday will be great.
Next Monday?
Can we see the sand playroom to see what it's like so we can tell Tammy?
What I'm gonna do is actually, what we're gonna do is, we just plan, so maybe next Monday, what we'll do is when we walk out, actually, I can actually show you the sand playroom, show you the various figures and toys that we have in there, and then we can go and actually talk to the front desk, and actually, because they organize the calendar and stuff, so we can see if next Monday is available, and then the time that you like. Okay?
Thank you.
Thank you. It was very nice meeting you.
Yes.
We can actually go out right now.
You left your papers.